A lot of people suffer from low back pain or pain that seems to travel between the low back and the hip flexors and tightness in all those muscles. If that's you, then watch this video to discover the Psoas link and 3 exercises to get to the root cause. Coach E from Precision Movement here, and something that some people come to me and that has them really confused is they'll tell me, Coach, I've got pain in one area of my body, but it seems to travel around to different areas of my body. Or they'll have pain in one area, they'll work on it, that'll resolve, but then they'll get pain somewhere else. And why does that happen? Well, that often happens because of this, a compensatory MAP. And MAP stands for movement and activation pattern. And this is something I talk about a lot here. So what is a compensatory MAP? Compensatory MAP basically is when one muscle tries to pick up the slack for another muscle that's not doing its job. Really simple example is at the elbow here. If you're doing bicep curls, there are 2 muscles that contribute to that the most. We've got the biceps brachii, that's the which way to the beach muscle. And then underneath that, we've got a muscle that's even bigger called the brachialis. Now, if one of those muscles, let's say the brachialis isn't working well, then something else has to do more work, and that's the biceps brachii. Well, over time, that's just like if you're working at the office too much. Sooner or later, you're going to get burnt out. This muscle is going to get chronically sore and tight, and you might even tear it. Now, this is also something that commonly happens around the low back, hips, and pelvis. All of the sitting we do weakens a lot of these muscles. It gets our pelvis and our low back out of good posture and alignment, and we have a lot of problems because of that. So when it comes to the low back, there's one muscle that is commonly found to be weak and small, and that muscle is the multifidus. The multifidus is the deepest muscle. It's one of the deepest muscles of the whole spine, and it plays a really important role in stabilizing the spine, not only in a fixed position, but also dynamically. It helps the spine maintain good position as the spine is moving around, because our spines aren't just sticks. We've got many joints along the whole spine that are all designed to move. Now, there have been a lot of studies that have investigated this, and the research clearly shows that the multifidus muscle tends to be smaller and has a greater percentage of fatty infiltration in those with low back pain compared to those without. And that basically means it's smaller, it's weaker, and it doesn't work as much as it should be. Now, if you followed me for a while here, especially if you've seen some of my content on low back pain, you know that there's another muscle that's really important to address, and that muscle is the psoas. And the reason why is because if you look at it, it's very similar to the multifidus in that it's a segmental muscle spanning the entire lumbar spine, and it's the other deepest muscle of the spine. And when you take these 2 muscles together, you see that the multifidus is on the back of the spine, the posterior aspect, and the psoas is on the anterior aspect. And when both of those muscles are working right, well, you can imagine that it keeps the spine nice and tight. So why do people with low back pain often also complain about tight hip flexors or hip flexor pain? Well, that's because of compensatory MAPs. The multifidus often doesn't work well. And when it's not working well, the psoas is the muscle that will try to come in and pick up the slack. But it's not meant to do all that work, and soon it gets overloaded, stiff, and sore. We've got the rectus spinae, the abdominals and obliques, and even the lats can help try to compensate for a weak multifidus. But because the psoas is the closest in anatomy and function to the multifidus, it's often the first one that comes in to try to help out. And while I've been saying this for years now, the research is starting to catch up. For example, this study titled Fat Infiltration of the Posterior Paraspinal Muscles is inversely associated with the fat infiltration of the psoas muscle, a potential compensatory mechanism in the lumbar spine. And what these researchers found was that as the fatty infiltration of the posterior paraspinal muscles, which includes the multifidus, increases, the fatty infiltration of the psoas decreases. Increased fatty infiltration is a surrogate marker for a decrease in muscular strength. Since the psoas and the posterior paraspinal muscles both segmentally stabilize the lumbar spine, these results may be indicative of a potential compensatory mechanism. To sum this up, those with low back pain often have weak multifidus muscles, so we got to fix that. But the pain can be prevented by the psoas compensating, but this can only happen for so long until the psoas gets chronically stiff, sore, painful, and eventually the low back pain returns because the psoas can no longer compensate. So if you're one of the people who seems to have pain that goes from the low back to the hip flexors and vice versa, or both areas are just stiff, painful, and sore, then the 3 exercises we're about to go through will really help you out. The first exercise we're starting with is called the Multifidus Activator. For this technique, you got to take your shirt off. Just kidding. You got to get into the 4-point position, and you start off in a flexed position. So like the camel in a cat-camel. From here, you simply think of anterior pelvic tilt and lumbar extension. Nothing else moves. So you're trying to flatten out the lumbar spine, anteriorly pelvic tilt, and this is going to wake up that multifidus muscle. And you hold it there in that position for about 10 to 15 seconds. Then you reset, get into the camel, flex everything, and then just think from the bottom up, anterior pelvic tilt, then lumbar extension, and keep getting deeper into those ranges, anterior pelvic tilt and lumbar extension, while keeping everything else flexed, the thoracic spine and looking down towards your thighs. So keep activating and contracting those deep muscles there. Reset and do it one more time. You might not be able to feel it too much at first, but keep working at it and keep picturing where those muscles are and what you're trying to do. You're trying to extend segment by segment in the lumbar spine, and eventually those muscles will wake up, and now you'll be able to integrate them into other exercises, which we're about to get to. The second exercise is the lumbar control. And for this, you got to pay attention to this area, which is known as the PSIS, the posterior superior iliac spine, because you want to keep that area with constant pressure on the floor throughout. You also want to keep a neutral lumbar spine so you can fit just your fingers underneath your low back here and maintain a little bit of pressure between your low back and the fingers. From here, you're pressing a foam roller. This is about 12 inches apart. And the reason why I want this is because it puts you into external hip rotation and helps you to bias your psoas. So keep your psoas active throughout. What you're doing is you're lowering up and down super slow. This is real time. We're going slow-mo here. You try to flex your hips, bring your knees up as far as you can while maintaining the pressure on your PSIS and the pressure on your fingers on your low back. So you're just moving up and down. When you get to the bottom, you're touching your heels and you're hovering your heels, just lightly touching the ground. So your hip flexor muscles are active here. Hold for about 5 seconds, and you're not really squeezing the roller, you're just keeping it there. You're not trying to squeeze it at all. Then you slowly lift up, maintaining control and pressure on the PSIS and your fingers. So you're maintaining that lumbar position. Hold it for 5 seconds at the top, and then you repeat, slowly going, because you want to focus on your ability to maintain pressure on the PSIS and your fingers throughout this exercise. That's the most important thing, is the pressure on the PSIS and the lumbar spine. And you're flexing up, keeping pressure on those areas. You'll have to adjust, you'll lose it, and then you'll just have to adjust, and that'll wake up those muscles and reintegrate those muscles, get them working together properly. And also make sure you're breathing naturally throughout. The last exercise is the standing dead bug. First up, when we lift the leg, we want to go into external rotation, we want to suck the leg into the socket, and we want to level the pelvis out. From here, we apply pressure with the opposite hand and hold that for 5 seconds, standing tall while breathing. Now keep the hip flexor on as you lower down, and then you switch sides. Lift the leg, externally rotate, suck the leg into the pelvis, and make sure the pelvis is level, and then apply pressure. Hold that for 5 seconds while sucking the leg in and applying pressure, and then maintain activation of the hip flexors, of the psoas, as you lower down. So keep those muscles contracted. Switch sides, flex the hip, externally rotate, make sure everything's level, and you're sucking the leg in as you press. Hold for 5, breathe naturally, stay nice and tall, and keep the psoas contracted as you lower down. You could tap it like I am to keep that activation. Flex the hip, externally rotate, press, and make sure the pelvis is level. You're not hiking the hip and overusing the quadratus lumborum and oblique muscles. Keep that contraction through the psoas as you lower slowly. And that's the standing dead bug. To summarize the 3 exercises we went through, we started off with the Multifidus Activator, performed 3 reps holding for 10 to 15 seconds each. After we've woken up the multifidus, then we go to lumbar control For this technique, you can do 2 sets, anywhere from 3 to 5 reps, holding for 5 seconds on either end of the exercise. And we finished off with the standing dead bug. Do 2 sets of 4 to 6 reps, holding each rep for 5 seconds. So now you understand the mechanism behind why pain can travel to different areas of your body and exactly what to work on if you've got low back pain and hip flexor pain or tight hip flexors and you want to get to the root cause for lasting relief. If you want to learn more about how we do these things, you can check out these videos. And if you've got low back pain, then I suggest you grab the Low Back Pain Solution Program because it includes the approach and the concepts that you've learned here, but with many more exercises to deal with all the different compensations that can happen. So I hope you enjoyed today's video, and I'll see you next time.